It is 10:05, and I've been tasked with staying on time, so on time is what we will do. I'm Sarah Umar. I'm one of the gastroenterologists here. I'll be moderating this second session. We do not have any movie stars in this session, unfortunately, but they are all rock stars in their own, just in different ways. So our first talk is by Dr. Roust. She's one of our endocrinologists here. She's an expert on obesity, and she sees a lot of our patients because, as you know, GI conditions and obesity frequently overlap. So we look forward to hearing what Dr. Roust has to say. Thank you.
Thank you. Good morning, everyone. First of all, I want to just thank the organizers of the meeting for inviting me this morning. This is probably one of my favorite topics, so we'll just make this a real quick kind of overview because obviously treating obesity is a very multifaceted approach to treating the condition. So we'll just kind of go on. First of all, I have no disclosures. Basically, what I want to do today is give sort of a general overview of how to approach treating obesity. I know that as gastroenterologists, the majority of you probably won't be doing a lot of in-depth treatment, but I think you'll be seeing people who are on treatment and understanding the whole process that we go through and how we look at treating weight problems is helpful. We'll also spend a little time talking about some of the newer weight loss medications and what we can expect from them. So to start with, when I'm seeing somebody for a weight issue, we start with the history. How did they gain weight? How did they lose weight? What's worked, what hasn't? What kind of medical problems do they have related to their weight, whether it's metabolic or mechanical? So diabetes, hypertension, NASH, metabolic syndrome, those are all some of the metabolic problems that can respond to oftentimes very modest amounts of weight change, whereas the mechanical complications such as sleep apnea, GE reflux, and degenerative arthritis oftentimes require more significant weight change. And other things that we think about, cardiovascular issues, psychological issues, because that can really be an impediment to changing behaviors, and so we really want to address those too.